has rebooted her computer. But my name is Jeanette Mott Oxford, and I am Director of Policy and Organizing for Empower Missouri. That may be a new title to some of you who know that I was the Executive Director of the organization since 2012, but I have taken a new role as we've done some strategic planning about how to be strong into the future. So we will be announcing a new permanent Executive Director soon. I'm glad to be with you today. And on this World AIDS Day, in the midst of a pandemic, I'm just struck by how different things are now than they were in the 1990s. And it's a good reminder to us in these hard times of COVID-19, as our hospitals are full to overflowing with people who have COVID-19, as we just don't know what way to go about so many things about public policy around the pandemic right now. We will find our way forward. There are things that we can learn from what happened around HIV and AIDS. There are many lessons that we can learn. And I think, two main things are there's medical progress. Today, people living with HIV can have a long, healthy, active life, a life that on average is pretty much the same length as other people's lives are. And then community. That it's important that we take care of each other. And people living with AIDS did a wonderful job of creating a network of support for themselves and working to end the stigma of having HIV. So today we celebrate progress that's been made, and we celebrate progress that will be made as some legislators are on the press conference with us today, who are offering some legislation to move Missouri forward in the area of HIV policies. There's mistakes that were made in the past. We have HIV-specific criminal codes that are not medically accurate and that work against public health, and it's important that we change those. There are some new things that we can do around medicines that prevent transmission, and there's policies that we can use around harm reduction related to injectable drugs. And there's going to be legislation that's offered to make progress on all of those. So, Molly, do we have Representative Rehder on the line yet?
It does not look like it.
Okay. What I'm going to do is go ahead and shuffle the order slightly then, and I'll begin with Representative Christofanelli, who is carrying legislation on the House side that Representative Rehder has carried in the past. When Senator-elect Rehder joins us, we will move to her. And then Representative Christofanelli also has some other legislation that is a wonderful public health advancement that we hope will also pass. Representative Christofanelli is a Republican who represents part of St. Charles County, including part of St. Peters, where he resides. He has just been reelected to his second term, and we invite Representative Christofanelli to speak.
Hello, everyone. I'm Phil Christofanelli. As JMO mentioned, I am from St. Charles County. I am filing two pieces of legislation this year in order to help address our HIV epidemic we have across this country. Most important to me, I think that we need to let people know that while science has not yet found a way to cure HIV, we certainly have the tools at our disposal to end HIV if we take the correct actions. And so to that end, I intend to file two pieces of legislation in the upcoming session in order to put Missouri at the forefront of preventing the spread of HIV in our communities and helping those who currently are afflicted with this disease. And those two pieces of legislation, one which you will hear more about from Senator Rehder. She has carried for the past 4 years in the House, but we have not yet been able to get it enacted into law, deals with the many places throughout our criminal code where we specifically target people with HIV. And those laws were written some time ago, before our science had really developed on how this disease was transmitted and how it spread and its life cycle throughout human medicine. And as a result, there are instances where people with HIV are unfairly punished, sometimes for actions which have no scientific chance of spreading the disease, and sometimes they are unduly punished in comparison to other diseases which are equally serious. And so that bill goes through our criminal code and tries to update the language in order to reflect the developments of science that have occurred over the past several decades. The other piece of legislation is a relatively new idea, which has only been implemented in one state in the country thus far, and concerns two HIV prevention drugs that are of relatively new invention, but are critical in the fight to end HIV. And those drugs are known as post-exposure prophylaxis and pre-exposure prophylaxis, also known as PEP and PrEP. These drugs, if taken, can completely prevent someone from transmitting the disease if they've in fact been exposed to it. In the case of post-exposure prophylaxis, if it's taken within 72 hours of exposure to the virus, it can make it almost impossible for the person who takes the medication to actually become HIV positive. There is an issue, though, that affects many people throughout the country and in the state of Missouri, where if you have to get a doctor's appointment in order to be prescribed this post-exposure prophylaxis after you've been exposed, your doctor's appointment may come after the time when you need to take the medicine in that critical 3-day period. And so what my bill would propose to do would allow the pharmacists across our state to screen people and ultimately prescribe them this life-saving medication before that critical 3-day period has expired. And so it would allow over-the-counter prescriptions by pharmacists of PEP. It also would allow people to access the pre-exposure prophylaxis, a 30-day supply after they receive an HIV test that's negative. A physician would be able to, a pharmacist would be able to prescribe a 30-day prescription of those medications as well. And when people are taking the pre-exposure prophylaxis, it makes it nearly impossible for them to contract HIV even if they're exposed. And so through these two bills, we really hope to turn the tide of this public health crisis in our state and be a leader among states in helping stop the spread of HIV and ending HIV in our time. And so I thank everyone for coming here on World AIDS Day to be a part of this announcement. And I look forward to working with all the stakeholders and public health groups and other members of the legislature in order to accomplish these two bills in the course of the next legislative session. Thank you.
Thank you, Representative Christofanelli. We will do some question and answer later, but we'll let all of the speakers go first, and then they have a big block of Q&A. We're glad to see that Senator-elect Rader's connection is now working. She texted me country life. We know that we need to beef up our broadband access in Missouri, and hopefully we'll be able to do that real soon. That would be a needed investment in our state. Representative Rehder, a Republican, represents parts of Scott and Mississippi counties, District 148, and has served 8 years in the House and recently was elected to Senate District 27. So we are excited. Last year, we were excited that we had a senator ready to offer the bill over on the Senate side, but Senator Curls moved on before she could really do anything with that. So this year, we'll have the bill moving in both chambers, and we're very excited about that. So Senator-elect Rehder.
Okay. Can you guys hear me all right? Excellent. So yes, thank you so much. And I'll try not to reiterate some of what Representative Christofanelli said. I'm so excited to have him on the House and me on the Senate side. working to push this through. I think that, as you guys know, I'm filing again the harm reduction package, which is the PDMP, the syringe access, and our communicable disease bill. And so I think that having a passionate sponsor on the Senate side for those three as a harm reduction package is going to be very important. And you know, and how special that today is World AIDS Day, and we get to file our bills on this day. It's so significant. And you know, we've had so many advancements in HIV treatment since the 80s when our statutes were put into place. And medical professionals, researchers, scientists know so much more about it now than they did then. And, you know, living with HIV is not a death sentence any longer. And to ask the general public that, they don't know that. And so I think that that's incredibly important in removing the stigma of the virus and helping people to understand that the medications are available. We do have the ability to eradicate AIDS. And so it's so important that we get these bills passed. It's so important that as a body on both sides of the aisle work together for this, this harm reduction. It's very much for our health, for the health of our communities. We have in 2018, we had the CDC put out a list of the counties, the top counties across the US that were in the midst of outbreaks or at high risk for outbreaks. Missouri had 13 counties on that list at the time. 2 of those counties are in my incoming Senate district. And so to me, it's very important more than ever before that we educate the just the population to understand that there's only 3 ways to that you can transmit HIV: through blood from mother to the child and unprotected sex. And so with Missouri laws as they stand, they work as a disincentive to knowing your status. And so that's what we want to change. And that's what this bill will do, in my opinion. And I think Representative Christofanelli hit on the things that it changes. You know, we certainly want to be sure that we're giving access to organ donors. And that's one of the things that Missouri law prohibits if you are HIV positive, that other states have been allowing for years. And so we want to be sure that we have that available also. We want to remove the HIV-specific language. How awful that we name one virus above all others in our statutes. I think that, you know, we have Hep C, HPV, we have other viruses that do lifetime worth of damage, but those aren't listed individually in our statutes. And so I think that it's high time that we get this fixed. You know, and we've spoke about it many times. If someone is purposefully transmitting HIV, they absolutely need to be prosecuted to the full extent of the law. That's not what this is about. This is about encouraging people to find out their status, get on the medication so that we can actually prevent transmission and help people live long, happy lives. And so with that, I'm happy to answer any questions, or if there's anything I missed, Jeanette, that you'd like for me to cover, I'm happy to.
Thank you, Senator-elect Rader. We will turn to a few other people and then come back to you for Q&A along with our other guest speakers. Our next speaker is Greg Razer, who is a state representative for parts of Jackson County, District 25, just now, and has served a couple of terms, but he's just been elected as Senator-elect for Senate District 7. And so I learned as we were planning today's press conference that he's going to be teaming up with Representative Christofanelli to offer the PrEP bill over on the Senate side. So Representative and Senator-elect Razer, please speak.
Thanks, Jeanette. Thank you all for being here today to listen to this press conference on World AIDS Day. And this is always a conflicting day, I think, for a lot of folks who have lost friends or loved ones to HIV and AIDS. It's a day to commemorate, but we're also in a time to celebrate because you're starting to see the light at the end of the tunnel of this pandemic that began late in 1980. And I think it's important as we go through to understand that a lot of our fellow citizens, a lot of our fellow legislators, probably have not been following the medical progress of HIV for some time now. Thankfully, medicine got us and science got us to the point, and by the late 1990s, that HIV was no longer a death sentence. But today, it's a very manageable chronic virus to deal with. And I want to talk a little bit about that because I think it's important to understand that in order to understand Representative Christofanelli's PEP and PrEP bill, which I'm going to be happy to have filed in the Senate. An HIV positive individual today who takes their medication is very likely to have what is known as an undetectable viral load, which means if you draw blood from that person, there are no copies of the virus remaining. The CDC has confirmed that individual who remains at an undetectable viral load status is untransmittable. There are still individual dormant copies of the virus in the body. If the person comes off of their medication, it will revive itself. But so long as they stay on medication, they cannot transmit the virus. That was the most important piece, and is piece one of suppressing this virus out of existence. Piece two is the fact that about 15% of people infected with HIV don't know that they're infected. So those individuals are spreading the virus. So if we get people who are at high risk of contracting HIV, and we can get them on PrEP, which is a medication that will kill the virus in your body if you're infected before it can embed itself in the body, so that you never become HIV positive. If we get people who are at high risk to be on PrEP, then that's another huge part of suppressing the virus out of existence. And then the third piece is PEP. Folks who may
Greg, we can't hear you. Your picture is frozen. Are you able to reboot and come back to us?
If he's frozen to us, we're probably frozen to him too.
That's possible, yeah. I will text him to let him know. So, while we're getting things straightened out with Senator-elect Razer in the world of Zoom press conferences where things will go wrong, I will go ahead and turn to Molly Pearson, who is our justice organizer with the Missouri HIV Justice Coalition. Empower Missouri staffs the Missouri HIV Justice Coalition. And Molly is going to make a statement and introduce you to some members of the coalition that are very anxious to see us improve public policy about HIV.
Thank you, JMO. So it's an honor to be here on World AIDS Day. In the years we've been pre-filing legislation to modernize our state code, it's never fallen on World AIDS Day. So it's pretty special that we can do this today. Missouri is one of 7 states identified by the federal government as a priority jurisdiction for phase 1 of the National Ending the HIV Epidemic Plan. And the plan relies on data science to inform where intensive testing and linkage to care should be administered across the state. And on the surface, this sounds like a great idea, but it also highlights a grave concern. HIV is severely criminalized in Missouri, and you can only be prosecuted if you know that you are living with HIV. So while knowing your status is the first step to being linked to HIV services and care, in Missouri, it also means that it makes you vulnerable to unjust criminalization in the blink of an eye. Our state's antiquated and harmful HIV-specific laws criminalize actions that we definitively know cannot transmit HIV, such as spitting. Our law also places the burden of proof on the accused. People living with HIV must be able to prove that they disclosed their HIV status to sexual partners. And in the courtroom, it often essentially comes down to one word against another. And people living with HIV are considered guilty until proven innocent. Our state's HIV-specific law was originally passed in the late 80s, when our cultural understanding of HIV was informed by fear and stigma. And thanks to advances in modern medicine, people living with HIV can live long and healthy lives without transmitting the virus. Using criminalization as a public health intervention simply does not work, and it upholds the stigma and fear of HIV that got us where we are today in the first place. This work is personal to me. Both of my biological parents died of AIDS-related illness. My dad in 1989, followed by my mom in 1994, just 2 years before breakthroughs toward truly effective treatment were achieved in 1996. To think that they could face felony charges for their health status if they were alive today is unacceptable to me. When I think of my parents, I think of every Missourian living with HIV. I think about how people living with HIV deserve to thrive, and they deserve to love and be loved. We must modernize our state's HIV-specific law if we want to meaningfully support people living with HIV in Missouri. And I am honored to pass it to one of our founding members, Latricia Miles, a founding member of the Missouri HIV Justice Coalition.
Thank you, Molly. Can you hear me? Okay, great. I am Latricia Miles, and I just wanted to cover some of the things that some of you have mentioned, as well as some of the emphasis that we want to express during World AIDS Day. The United States Ending the HIV Epidemic Plan outlines clear benchmarks to end HIV transmission by 2030. Missouri has been named a focus state due to the continued rise in HIV cases. As a result, Missouri was also added as a target state in the nationwide Get Tested campaign. The criminalization of HIV impacts the ability to stop transmission in Missouri. Thanks to advances in modern medicine, people living with HIV can live long, healthy lives without transmitting the virus. Criminalizing a treatable medical condition simply doesn't make sense. The way the law is written, the burden of proof lies with the accused. You are guilty until proven innocent. This has a chilling effect on people's willingness to be tested because you can only be prosecuted if you know your status. I have known my HIV status since being diagnosed December 15th, 1995. All I could say about that day was that I have 3 small children, 11, 8, and 4. Soon after my diagnosis, I picked out my casket and made my burial arrangements. 25 years later, I am still here. And I've set myself on a course to not count my years, but to make my years count. The Missouri HIV-specific law was adopted during the height of the epidemic, before HIV was considered preventable and treatable. Since the initial criminalization of HIV in Missouri, our state has since amended our laws twice to be even more punitive. In other words, as medication progressed, our laws regressed. Yes, I have lived with these antiquated Missouri HIV criminalization laws for 25 years that don't support science, that stare me in the face every time I step to the finish line. I am a runner. Runners spit, but spit does not transmit. Could I be arrested at the finish line? What we know is that these laws stigmatize persons with HIV. And when stigma is up, so are HIV transmissions. There is a growing movement nationally and globally to modernize these laws. Our neighboring state of Iowa has done it. The American Medical Association, the Association of Nurses in AIDS Care, and many, many more organizations are all in support of modernizing these laws. Missouri, let us not remain stuck in an old law from the 80s. By amending Missouri's HIV-specific law, we will remove a significant barrier that keeps people from knowing their status, assessing care, and preventing transmission. HIV is not a crime. Thank you.
Thank you. Founding member of the Missouri HIV Justice Coalition, Latricia Miles. Next, we're going to pass it to Lynn Meyercord, the Executive Director of AIDS Project of the Ozarks.
Hello, is my microphone working? Hooray, okay. I'm not gonna repeat because a lot of folks have already hit on some very important points, so I'm not gonna read my statement. I am gonna say that a harm reduction package fills my heart with joy. I've been doing this since the 80s, and anyone who's worked that long in this field or the field of the opioid epidemic or so many other issues knows that harm reduction is key. And we know better now, so we need to do better. The laws, as has been stated, they don't reflect scientific reality anymore. 80% of new HIV infections can be traced back to folks who didn't know that they were infected. The stigma continues, and it needs to be addressed in a scientific and legal sense. Also, I'm so happy to hear about the syringe exchange program. That we are very hungry for that here in Southwest Missouri. Serving a more rural part of the state, I can tell you that stigma is a huge barrier with so many health issues and particularly HIV. And if there's some acknowledgement by the legal folks and by our legislature that these changes need to happen, I think that will go a long way in making a difference for folks. Certainly those that are living with this virus, and as Latricia said, having to deal with the stigma of being a criminal before you've done any criminal acts. I mean, it's ridiculous. So it also with our advances, prevention is now in the hands of the individual, and for that to be more available is another key to ending this epidemic. That's it.
Great, thank you, Lynn. And we now turn it over to Darius Rucker, the Director of Health Support Services at Williams & Associates.
Cool, thank you so much, Molly, and thank you everyone for having me and for being here. On behalf of Williams & Associates, we're excited to celebrate World AIDS Day with everyone in this moment. And so because of World AIDS Day is the reason that I know my own status, and that 10 years ago, I walked in to get tested for the first time and was diagnosed as living with HIV. So thank you all for having me in this space. And I really appreciate the work that the Missouri HIV Justice Coalition is doing, as well as Empower Missouri. Holistic care and support for all, especially those who are most affected by HIV/AIDS. That's the work of Williams & Associates. It is rooted in ensuring equity for those people who continue to face systemically oppressive systems. We are committed to seeing an end to HIV transmission by 2030. Missouri has been listed as a focus state, as so many others have mentioned, and we are committed to continue offering free testing, case management services, linkage to care, and social support groups. we ground ourselves on the necessity to make sure we're providing health services to vulnerable populations. It's so important that we name and center those who are most marginalized, especially in this conversation today, where we see rural populations affected. We see sex workers and injection drug users. We think about Black men who are same gender loving or queer, and Black women who are oftentimes at the bottom of that totem pole when we look at some of the different cases. We consciously name these identities to make sure that we are better prepared in tackling those social disparities and barriers beyond that HIV diagnosis. Oftentimes it's, okay, you know your status, now let's keep moving. And one of those large barriers is HIV criminalization. I didn't know that was a topic to talk about when I was diagnosed. I knew that I was scared to have sexual experiences with others, but did not know that there were people doing work on behalf of me at the time around HIV criminalization. And so want to continue to show my gratitude for that in this space. Our work every day with our community members is to help them and support them in reaching an undetectable status through medical care and holistic support from our team. And as stated earlier, once that undetectable status is reached, there is no risk for that viral transmission. The laws that are currently in place have become more problematic over time, despite us moving forward medically. HIV treatment is, get a test, go talk to a doctor, and there's so many different ways that, different medications even, that can support you in achieving that suppressed viral load. People are more penalized than ever before, it seems like, for living with HIV. Spitting and biting, right? We talked about that a bit. Those are punishable as felonies, 5 to 15 years. Sex workers see enhanced punishments for the offense of prostitution if they're living with HIV, moving that from a misdemeanor to a felony. We work at Williams & Associates to support people in living a full, healthy life. And the current criminalization laws do serve as roadblocks for us. If we work collectively to amend those HIV-specific laws here in the state of Missouri, I do believe we will establish a pathway of support and holistic care for our community. Again, thank you to everyone. And I love that Lynn seems to have already had my notes because I wrote verbatim. Maya Angelou once stated, "I did then what I knew how to do. Now that I know better, I do better." So I ask everyone to step back, reflect, and push yourselves to be better as we continue to learn. Let us decriminalize the virus. HIV is not a crime.
Great, thank you, Darius. We can now open it up to question and answer. And I'm also going to drop a link in the chat to a digital press packet that includes written statements from each of our coalition members who are here today, as well as a language chart on how to sensitively and appropriately write about HIV to make sure that we're using destigmatizing language, and also a one-pager on HIV modernization. So I'm dropping that in the link or in the chat here. And if you need it emailed to you, you can contact our communications director. I'll drop his email address in the chat as well. But other than that, we can open it up for questions.
Thank you, Molly. I'm going to turn first to Senator-elect Razer, who accidentally got paused on us just a little bit ago, in case you had a few closing remarks, and then we'll open it up to the media.
Yeah, I apologize for that. I think you lost me right around my third point. So I was just saying that, if we get everyone who is currently positive to an undetectable status, they can no longer transmit it. 15% of people who are positive don't know that they have it. Then there's a group of people who are at high risk. If we can get them on PrEP, then they can't contract the virus. And then PEP is the third leg of that stool. That would be a group of people who either don't have access to PrEP or not at high risk, who may have been exposed. They have 72 hours to get that medicine into their body before the virus embeds itself in the body. By doing that, I don't know if we eradicate the virus, but we suppress it out of existence. And I think the last thing I said was that we know this can be done because science is on our side, the medical community is on our side. And you're seeing today at this press conference, bipartisan, bicameral leaders right here in Missouri that are working to make this happen.
Thank you, Senator-elect Razer. For those in the media, if you'll either use one of those things down in the reaction box, like I've just put a hand up there by my face. You can see if you click on reaction, you can pick a hand. It's really supposed to be kind of an applause thing, but that'll let me know you raised your hand. Or the thumbs up, that's good. Thank you, Tessa. Or you can do that also in the participants. It allows you to raise a little blue hand. If you're cold today, because the weather got really cold, didn't it? You can raise your little blue hand today, and I can look for that as well. So we'll call on Tessa from Missouri Independent for the first question.
Hi, thanks for doing this. For the lawmakers, I guess one of my first questions was just wondering if you could speak about what some of those barriers that you faced to passing these bills were in the past and how you hope to overcome those this year.
I'll go ahead and jump into that. Representative Christofanelli just unmuted himself. Did you want to go?
I can talk about the PrEP bill last year. Actually was really well received. We took it to the House Committee on Professional Registration and Licensure, and it got a unanimous vote out of that committee. The bill died, unfortunately, with many other bills as a result of coronavirus shutting down the legislature for 6 months. So I don't think it was a policy issue. It was just a procedural issue last year that stymied our progress. And that was the first year that bill was filed. Holly knows a little bit more about the other piece on decriminalizing HIV, and she could probably speak to some of the trouble she ran into when she filed that in the past.
Yes, so, our plan has been over the past few years to have the bill brought up in different committees. And the reason for that is because we want to educate as many members as possible. What has been incredibly reassuring is that this has gotten out of committee overwhelmingly bipartisan support for the last 3 years. And when the committee members actually get to hear the testimony of those coming and telling their stories, it's so obvious why these laws have to be changed, must be changed, to help remove the stigma, to help get people tested, to help eradicate this virus. And so it's been very important to us each year to get it into a different committee. Now, this past year, our committee time was cut incredibly short because of another bill that was in the same committee at the same time. And I felt that really harmed us. We didn't, the folks who had come so far to testify really had their time cut short. And that bothers me a lot, of course. When people are when they've come so far and they're there to tell their own personal story, that our policies affect people's lives. And so when we got to the floor, over the last couple of years, last year mainly, we had many representatives then who were actually very knowledgeable about it because they had heard the bill in committee, they had heard it presented, they had heard the wonderful folks coming to testify. But then we still had so many that were uneducated. And it's certainly an educational process when you're dealing with something that like HIV, that the stigma is so huge. And of course, I'm someone who's been working on the opioid epidemic for years. And so I'm used to that. I'm used to it just being a topic that so many people want to stick their head in the sand about. So I think overcoming that stigma is the greatest barrier, but we are definitely making inroads in that. And so I'm not discouraged at all. I'm very encouraged this year that we're going to get to do the same thing on the Senate side while Representative Christofanelli is doing the same thing on the House side. It's really just a matter of education. And again, when I was speaking earlier and I said, I don't think many Americans even know that HIV is not a death sentence. Something as simple as that, not understanding where medical technology has us today. Those are things that we must make sure that every single member knows. And I think that's been our main hurdle. This being year 4, I believe, JMO, I think we're certainly in a much better position than we ever have been.
Hope so. We want this to be the year to end the stigma and change the law.
Yes.
Is there another member of the media who'd like to raise their hand or give us any kind of a reaction cone that you have a question? Tessa.
Yeah, I just had another question. Maybe this would be for some of the, advocates on the call, but I was wondering how you've seen the pandemic maybe affect access to care, and is there concerns that because of the pandemic, people aren't able to regularly access care as much right now, and I guess what you're kind of seeing around that?
I can jump in here. So I think some of the things we've immediately seen is just a decrease in opportunities for testing. Even at Williams and Associates, we are now appointment only, where before we were doing walk-ins, appointments, as well as actually going directly into the community to conduct HIV testing. And so we've seen a decrease in that. And I have additionally understood and heard for those folks who are living with HIV, myself included, some of those doctor's appointments had to be rearranged and or rescheduled. And obviously, if you're working to maintain a suppressed viral load, or even some other medical concerns that you might have, those things become very important to make sure that you are consistently taking care of yourself, even with the virtual visit, where, that we've experienced challenges here in this space, right? In the way in which we're able to navigate virtual communications. And so those things do become additional barriers as well as we think about COVID-19. I will also add, there is now an increased level of thinking about a second disease, right? And so figuring out, where to get a COVID test, can I do that at my infectious disease doctor, and so on and so forth, I think can add some additional stress that may lead to other things, whether that be mental health challenges, behavioral health, substance use, and so on and so forth.
This is Latricia, and we've seen a reduction in testing as far as it being these laws being a disincentive to test. If I'm tested and my status is positive, and all of a sudden that's knowledge, then why test? Or either why give my name? I may want anonymous testing because I may be criminalized because of my HIV status, because the law as it is written, whether you have exposure or if a person transmits the virus, you are still prosecuted. And so there's no other disease, as Senator Rehder said, where you are criminalized for a virus, for having a virus. And so instead of, the laws being helpful, the laws are punitive for people living with HIV, and the laws do not serve public health. So it is a disincentive now to be tested for some folks, and not to talk about the stigma related to a person's status.
This is Lynn. I will echo what Darius and Latricia said. In our area, we serve 29 counties and over half of those are rural. So we immediately switched to a telehealth model, as I'm sure all the other folks on the call have. And a lot of our folks don't have access to reliable internet. So we're using the telephone as much as possible, but that's still not a substitution necessarily over the long haul for in-person visits. And certainly we've had our capacity to offer testing significantly challenged. And people are still having sex. I will say that hasn't seemed to slow down much, which I wouldn't expect it to. But now we're also facing the issue of a shortage in STI test kits because so many resources are going to COVID-19, which certainly is necessary. So there's several different obstacles, if you will, that are definitely affecting efforts to end the epidemic.
And Empower Missouri being a group that that has worked for over 100 years to try to make sure all Missourians have access to basic human needs of food and shelter, I must say that that COVID-19 and the HIV epidemic and the recession have disproportionately fallen on the backs of Black and Brown Missourians who are more apt to live in poverty, unfortunately, are more apt to be uninsured, which limits your access to medical care. Because of the recession, that 40% of Missourians have lost income since March, there are many people vulnerable to eviction, to utility disconnection, and families that are hungry right now. None of those things help your HIV, status to improve. The Kansas City Department of Public Health actually did a study to track what outcomes do you get if you help people be secure in an apartment versus people who have spells of homelessness. And they found that people who are steadily sheltered in an apartment make their doctor's visits on a regular basis and take their meds on a regular basis, and therefore are much more likely to achieve that zero viral load that people have been talking about. So one of the things that we're working on right now is drawing down. We were talking to Senator Blunt and Senator Hawley constantly about the need for more coronavirus federal relief to prevent evictions and prevent utility disconnections, because that housing instability that often comes with utility disconnection as well will mean that more people are homeless, living in their cars, couch surfing, going from place to place, and all of that transmits COVID. And it also makes you less likely to get good control of your HIV and achieve a zero viral load. So we think you got to cover the basics in our state if we're going to have a healthy state. It just makes sense to make sure everybody has food and shelter. So we're working very hard on that right now. Are there other questions?
Well, and just real brief, I want to say that, people can use your HIV status as a weapon as well. If you are involved in a domestic violent relationship, or if you're an immigrant, then the law as it's written, hey, I can go to police, go to, authorities and tell them that you're HIV positive. They may deport you, or you've exposed me to HIV. And this is a person that may knowingly know that the person is HIV positive, but they're using it as a weapon to possibly keep that person with them or harm them in some way and get away with it.
Thank you, Latricia. That's an important thing to add. A lot of people who are victims of intimate partner violence have been basically held hostage by the threat that someone will go and tell a lie to the law enforcement agencies about them, claiming that they didn't know their status and we weren't told, when really people did tell. It's hard to prove that you've told. That's what's hard about a disclosure law. How do you prove disclosure? Other questions from the media? Tessa.
Sorry, one more quick question. I was just wondering, with the bill's language of, expanding the definition in the criminal code just to a serious infectious or communicable disease, how would that maybe just interact, or I guess intersect with the, the coronavirus and, what we're experiencing right now? And is that something where, would that fall under that at all, or?
I'd have to double check the language, but I'm pretty sure that it excludes serious infections that are transmitted through the air. And I forget what the legal language to describe that is, but I believe that's an exception that's placed in the bill.
Right. We've occasionally had someone suggest they wanted to add airborne, and we've always said, no, we don't need to criminalize more diseases. So as it's written now, it would not, COVID-19 would not be something you could charge people with a crime. Did you have more to say about that, Senator-elect Razer?
And that's all I was going to say, is that we've tried to be incredibly careful about that, because we didn't want to pick up the flu or, some other things in the way that this was written. And so we have been very mindful of that in the way the language was drafted.
Thank you. Other questions from the media? Okay, well, we really thank you all for being here today, and we thank members of the Missouri HIV Justice Coalition, and it looks like we also have some of our allies at the Elizabeth Taylor AIDS Foundation that have joined us today as well. It's good to see their faces. So we thank everyone who's joined us, and this press conference is available as a recording on our Facebook page on the on the HIV Justice Coalition's Facebook page for those that want to go back and view it or share it with others, and that's a wonderful thing. Don't forget that in the chat box, Molly has posted a variety of resources for the media, statements that you can download, and there it is. Molly is on it. Thank you, Molly. All right, so thanks again to Senator-elect Rehder, Representative Christofanelli and Senator-elect Razer for being with us. Thanks to all of the members of the HIV Justice Coalition, but especially to Molly and Latricia and Lynn and Darius, who shared their experiences with family members, with themselves, and in the agencies for which they work today. Together we can end the stigma and change the law. Let's make 2021 the year that it happens. Bye-bye.